Hi everyone, and thanks for popping over to have a look at what myotherapy is. So my name's Claire, I'm the owner and myotherapist at CSTC Myotherapy based in Hobartville in the Hawkesbury in New South Wales. And today, as I said, we're going to go through what myotherapy is, some of the treatment modalities that we use, and have a quick chat about sort of injuries and conditions that we can actually help with. So myotherapy is a client-centered healthcare profession that focuses on the assessment, treatment, and management of the whole person. So we don't just look at you if you're coming with a shoulder problem. We're not just going to sit there and look at the shoulder itself. We're going to look at the whole person, look at what's happening in your body, around the area, what's connected to that, and what could be causing it. There may be something happening down in your pelvis that's actually linked up to the shoulder, because our body is all connected. All our muscles are surrounded by a fascia called a connective tissue, and that is all linked in from one end to the other. So top to bottom is all linked. So our approach is to look at the whole person, assess it, treat it, and manage it, making sure we're capturing the whole problem, not just the symptoms that are presenting to us. To do this, we apply a range of modalities, which I'm going to talk us through shortly, and we use evidence-informed knowledge to support our client outcomes. And that's probably the most important thing. We're always working with our client to help them achieve what they want to achieve. So if your goal is to be able to walk your dog around the block each day, and you've been struggling with that for some sort of a back problem or leg problems or even an arm problem that's actually stopping you from holding onto the lead, then our goal is to get you back to that point where you can actually go and walk your dog around the block. Perhaps it's even just so that you can actually go and do the shopping. So our goal there is obviously to make sure you can go in, push the trolley around, carry a basket, do whatever it is you need to do to live the life that you want to do. Perhaps you like running, but you've actually stopped going, you haven't been running for a few months now because your knee's been hurting. Our goal is to get you back out there running and doing what you enjoy. It could be your goal is to actually be out on the sporting arena doing your chosen sport. Obviously there we're working with you through your rehab to get you stronger and ready to go in those. So myotherapy treatments can assist and aid in the prevention, assessment, early intervention and treatment of injuries and pain, and also the ongoing management of chronic musculoskeletal conditions. Treatment doesn't just have to be post-injury. Once your symptoms have settled, then treatment can switch the focus to restoring your optimal activity, as I said, walking your dog, doing your shopping, playing your chosen sport. Also aiming then to reduce the likelihood of further injury, either to that site or other related sites that could be linked to it. And as I've already said, keep you moving and performing at your best, whatever that best happens to be for you. So one of the things I personally find as I treat, I make sure I'm always listening to my clients, listening to what they're telling me and trying to make sure I have a good connection with the client and what they want to know, what they want to achieve, what their goal is. My goal might be to fix their injury and help them get there, but I want to know what it is they want to achieve from being here with me. In terms of our treatment techniques, pretty much all the techniques we are using tend to have a similar physiological effect on the body in that it's increasing your blood flow to the area, stimulating the nervous system, and then stretching and relaxing the tissues, including both muscle and connective tissue, to help you with your movements. So one of the main ones I do use is massage. And so it's quite common that a lot of people will think myotherapy is purely a massage therapist with a fancy name. However, massage is just one of the many techniques we can actually use. We could also use joint mobilization. So joint mobilization is using a gentle back and forth movement. It's a little bit difficult to show on myself, but to mobilize my wrist, basically just moving it back and forth. I can also do it within joints, or the joints within the hand itself, and just letting it slide back and forth gently. It's not a manipulation. So manipulations are done by chiropractors and osteopaths, and it's where they're using a strong force to actually get the movement and shift the joint to the position they want it to be in. Never let anybody else do a manipulation on you. It should only ever be a chiro or an osteo who are properly trained and insured to do such maneuvers. So we will do joint mobilization, which is gentle. You can resist the movement. You can stop it from actually happening, as opposed to a manipulation where there's a strong force jolted through by the chiro or the table. In the case of chiros and osteos, they'll actually use a table sometimes where it will drop you and get the effect that way. Another technique we can use is dry needling. So dry needling and acupuncture are using exactly the same needles, but they're having different outcomes from the treatment. So acupuncture will work on meridian points or acupuncture points on long meridians in Chinese medicine. And their goal is actually to achieve an effect generally somewhere else in the body, not locally. And it's working a bit more in terms of energy and flow through the body. Dry needling for us is aiming to release trigger points. And a trigger point is a hyper-irritable point within a taut band of muscle that often has a characteristic referral pain. So your trigger points can be active or latent. So an active trigger point, you'll actually know about it as you're sitting there. You feel it, you can feel the referred pain. A latent one is one where I might just walk up, touch you in that spot and go, oh, I didn't know that was sore. Look, that's even referring up into my head. So it can be active or latent trigger points. We can release them through manual techniques as well, such as massage, different massage techniques to help release those. But dry needling is an alternative way that we can do it. So I'll actually just pull the needle out. If you haven't seen an acupuncture needle before, it's still very difficult to see on here, but they're very fine. And all we're doing is finding the trigger point. So if we find the spot about here, tapping it in, and then just a gentle rotation to work the needle into the point. And obviously the further the needle goes in, then the more it will hold itself up there on its own. You generally won't feel much with the needle going in. Sometimes you might get some redness around the spot. Again, that's just the blood flow coming through. It doesn't mean that you've actually hit a blood vessel or anything. And then again, very simple with taking it out too, and no pain generally involved either. So let's dispose of that into the sharps. An alternative with dry needling as well, and what research has generally found is superficial needling can be just as effective as needling into the trigger point itself. So what I have here is just a superficial needle. Effectively, it looks a little bit like having a Band-Aid. So I'll take the rest of this backing off. You can see a tiny little Band-Aid. You can see the white spot on there, which is the top side of the needle. Flick it over. This is a 0.9 mil one. So again, you're not even going to be able to see the needle itself in there. But it's one where you can stick it onto the spot where the trigger point is, and you can leave it on there for a few days at a time, and even just massage onto it yourself at any point. So they found that the superficial needling can actually have the same beneficial effects in that it's still stimulating the nervous system, which is then triggering the effects that we want to release the trigger point and the taut band basically within the muscle itself. Trigger points and acupuncture points can overlap. So it's not uncommon that a point where a trigger point is may actually also be a particular point on a meridian. But as a myotherapist, when I'm needling those points, my goal is to release those trigger points, and I'm not actually treating with the intention of altering energy flow or anything else through the body there. Okay. Next one we have is myofascial cupping. So I use a vacuum suction cup, such as this. This is just one of the small ones, and have a trigger gun, obviously, to create the suction through it. Some therapists may choose to actually use cups that require heat, so they're actually lighting a flame into it first, heating it up before they then stick it onto the skin. So these again can be used for trigger point release and also just general release of the tissue through the body. So it doesn't have to be an actual trigger point itself. It can just be areas where there's tightness through the body. We can use this to help release that. I often find myofascial cupping is extremely beneficial for those who struggle to tolerate any sort of pressure if I'm trying to massage. So instead, I can put the cups on them, and I find it desensitizes them somewhat. So it allows me to actually put some deeper work in and get the releases through the muscles that I'm after. So again, with the other techniques, when we're putting the suction on, place this on my arm now, but just a couple of little squeezes, remove the trigger. And again, you can see what cupping is doing is it's pulling the skin and the tissue underneath it up into the cup with the suction. So you can see the little mound inside there. This sits firmly. It's not uncomfortable. You can't really feel it, particularly when you're using larger cups on the back. Smaller areas, you can feel a little bit more, probably pull on the skin a little bit, but it's not a painful feel or anything else. So I'll just leave that sitting there for a few minutes. Again, as I said, we're trying to increase the blood flow to the area. When we increase blood flow to an area, we're improving the nutrient delivery and fluid delivery through to the tissue. And that obviously helps with healing and recovery within the space. It also places it on a gentle stretch, as you can see, because it's been lifted up, it's pulled out, so it's putting a tension through the skin and through the tissues. You can either do stationary, such as I'm doing now, or another way we can use the cups is to actually place a bit of oil on the area first and then just release it slightly and just gliding it up and down on the tissue. So gliding with the cups is very good sometimes on the back as well, if we're going up through the straps on either side of the spine and releasing tension and tightness through those areas. You may be familiar with the bruising that you can see sometimes from cups. You might have seen the big brown bruises on people's backs from it. That's actually quite normal. It's again just a sign that the blood flow has improved to the area. Some people will say that there's actually toxins coming up and being released out of it as well. Those bruises are generally painless as well, so you won't even be aware that you've got them there until somebody tells you about them. When we want to release this, simply lifting it off and off it goes. Having only been on for a minute or two, not going to see any bruising there, but generally you'll leave cups on for about 20 minutes. And so that's when you might start seeing the bruising occurring through there. I also like to use taping as a tool. I use Kinesio Tape, which has been proposed to have many benefits. Some of that includes your proprioceptive facilitation. So you'll see a lot of athletes using it now as well out in the sporting field, where they're using it as a way to, it gives you a cue basically as you're moving in a certain direction. If your joint's not functioning or sliding a little bit too far, it can just give you that little cue and help you switch the muscles on to come back to the right spot. So as I said, muscle facilitation, so switching the muscles on. They also believe it may help with reducing muscle fatigue, pain inhibition. It can enhance with healing, such as reducing swelling through an area. So while a lot of the taping you probably see a lot of the time, it's a thicker piece, you can actually cut the tape into fingers basically, lay it over an area that's we've got swelling in there, and using that can actually then help to reduce the swelling out of there. And it's also said to improve lymphatic drainage and blood flow in the area. So just to show you a little bit with the tape. So Kinesio Tape is a fabric type tape. When you're attaching it, we don't put any stretch onto the initial part. Let me just rub it on. As I pull the paper back. Always difficult when you're trying to do it one-handed. I'll remove that and try again. So we don't put any tension on the start of the tape as we lay it onto the skin. And as you pull the paper back, I'll just press that down again. You can actually see, so that's the tape at rest. You can actually stretch it right out and use it to pull across the skin. And then again, as you apply the very end of the tape again, you just lay that down onto the skin without any tension through it. And again, it actually creates a bit of a lift sensation onto the skin, which is very gentle. Don't necessarily notice it, but you can. It gives you a bit of awareness of things there and helps you with the prompt in some ways. And that lift is what gives you increased drainage and also the improved blood flow through the area. Another technique we use is stretching. So obviously we're trying to assist in releasing tight, short muscles that are creating a muscle imbalance in the body and obviously contributing to the injury or the pain that you might be experiencing. So obviously there's a variety of stretches that we can do. Static ones where you're literally just sitting there holding the stretch. Dynamic, which are things where you're actually sort of moving as you stretch. So you'll see footballers quite often will stand there swinging the leg. That's a dynamic stretch. Dynamic stretches are extremely good for warm-up rather than doing your static stretches instead. In clinic, I'll use a lot of Pnf stretching, so proprioceptive neuromuscular facilitation, where that's a stretch where I'll put you into a stretch position, hold you there, and then I'll get you to actually push against me. And I'm trying to hold that position. So then I get you to relax and we'll take the stretch a little bit further. So with any stretching, we're aiming to improve the muscle function, because a short, tight muscle isn't going to switch on and fire as we want it to in normal movements. So we need to release the muscle, get it moving and get it functioning, and it's also improving your range of motion through there. I also do a lot of corrective exercise work. So exercises will help with both muscle imbalance, limitation in your movement patterns, so your range of motion. We're obviously trying to, with the exercises, either try to improve your range of motion or we're trying to improve your strength, as well as also trying to get those muscles to fire in the correct pattern so that you're moving in the right way so that you can actually return to the activities you want to do. So quite often, if you've had a leg injury, a hip injury, or even a back injury, you might find that it's been more comfortable for you to change the way you walk. In doing that, that'll actually have the muscles sort of relearn how to walk a little bit and not necessarily function in the right way or firing at the right time. So we can give you exercises to do that'll help you actually get those muscles to switch on at the right point in your walk, in your gait, as it's called, and getting you to actually step through and moving and lifting in the right way. So when muscles don't fire correctly is actually when we start seeing injuries occurring. So muscles that don't fire the correct way when you're walking can actually contribute to your back injuries and things like that. The last thing I wanted to cover off here is types of injuries that we treat. Effectively, myotherapy can treat any sort of musculoskeletal condition. So whether it's back pain, sciatic issues, neck pain that's causing headaches, shoulder problems, rotator cuff issues. So the rotator cuff are the muscles that are responsible for the rotation of the shoulder in and out. Injuries that occur just from overuse, so repetitive strain things. So it could be sitting at your desk using your mouse. Obviously, tends to be a repetitive movement, always with the same arm, usually our dominant one. And it could be that you end up with wrist, elbow, shoulder problems from that. Also just injury or pain and issues that can develop just from, again, sitting at your desk, having your arms forward the whole time where you're shortening your chest muscles. So we do a lot of our activities in front of our body, which means we always tend to have our chest muscles shortened rather than having them back in a relaxed position. So we can help you with those sorts of things. We can help with foot, ankle issues, Achilles problems, plantar fasciitis, elbow issues. We can also knee issues as well, and also chronic pain presentations and fibromyalgia, things like that. In the case of chronic pain conditions, a lot of the work we're doing is to help you manage the pain and ideally give you some relief as you go. And obviously, it's a long-term process in those, particularly in those cases. So we're obviously working with you to find exactly what techniques work best for you to give you the most relief that we can give you. So thank you very much for joining me today. I hope that you now have a better understanding of what myotherapy is and how it may actually help you. If you do have any questions in the near future, please feel free to drop me a message on Facebook, Messenger, through my email, or sending me an SMS, and I'm more than happy to answer questions. If you want to book in, then again, any of those channels, and also booking online through my website as well.